Hello, my name is Cindy Wise and I'm a student nurse practitioner, and I'm going to be doing the assessment of the heart, lungs, and the chest today. And this is Sean, and she's agreed to be a volunteer for my assessment, to be my patient today, and she's over the age of 18. In a normal clinical setting, we would have the patient undress and expose the skin so we could do the assessment, but for the purposes of this video, we're going to leave the clothing intact. So Sean, the first thing I'm going to do is I'm just going to assess your heart, and I'm going to start doing that just by looking at you and assessing your skin. I'm going to have you do some things. I'm going to assess you with you sitting up, leaning forward, and then laying down on your back, and also turning over onto your side. And so if you could just lean forward for me for a minute, and just kind of put your hands down to the side. I'm just looking here to assess the apical pulse of the heart to see if there's any pulsations that I can see externally, and I don't, so you can sit up. And then I'm just going to look at your chest, and I'm going to ask you to raise your arms up. Good. I'm also looking at your skin to see that you're not cyanotic anywhere, your lips are not blue, and your fingernails are pink, and you have good capillary refill. So that's all good. So next I'm going to ask you to lay back on your back, and I'm going to palpate your apical pulse, which is in the 5th intercostal space, and I can feel it. And at the same time that I have my hand here, I'm going to also palpate your carotid artery. And they're simultaneous, so that's normal. They should be in synchrony, and they are. So while I'm here, I'm just gonna, I don't feel any abnormal pulsations, and there's not a heave or a lift that I can see, and no thrills that I feel. So I'm gonna go ahead and I'm gonna palpate your pericardium area. I'm just gonna feel here, and here, and up here at the base of the heart. And what that does is we're just feeling for any abnormal pulses around the boundaries of your heart in the chest, okay? So next I'm going to percuss the boundaries of your heart here and just listen for any abnormal sounds. I'm going to start here at the mid-axilla, sternal, then go up. Okay, and that all sounds real good. We're listening to hear the changes in the sound from resonance to a dull sound, and that means that when it changes sound, it goes over the bone, it sounds dull, and when it's in the lung area, it sounds a little different. So I'm going to go ahead right now, and I'm going to auscultate your breath sounds while you're lying down here with the stethoscope. I'm going to listen for your listen to your valves is what I'm going to do of your heart. And I'm going to start with the aortic and the pulmonic and Erb's point and the tricuspid and the mitral. And if I could just have you roll over on your left side, please. And this time I'm going to listen with the bell of my stethoscope. All in the same places. Okay, good. So you can set up. And what I was looking for there was your rate and the rhythm of your heart. I heard the S1 and the S2, and that's normal. I didn't hear the S3 or the S4. And when I had you laying on your left side, if there would have been an S3 or S4, it would have been easier to be heard. And I didn't hear any splittings, no snaps or clicks or rubs or any murmurs. If I would have heard a murmur, that would have been abnormal, and I would have listened to the characteristics of the murmur, such as the timing, the pitch, maybe the intensity, the pattern, the location, the quality, and the radiation or the variation with your respiratory phases, if it changed any. So that concludes the assessment of the heart, and we're going to move on and go to the chest and the lungs. So we're going to start again with the inspection of the chest, and if you could just sit with your arms across your chest there. I'm going to just watch you breathe. I'm going to look again at the front and the back. And I'm also going to look at your AP diameter. And the lateral side is much smaller than the anterior. It's not as wide, and that's normal, because if it were, what we're looking for is for barrel chestedness, which is not is an abnormal condition. I don't see any superficial venous patterns on your skin. There's no prominences in your ribs or any concave in your ribs, so that's normal. Your respiratory rate seems to be with ease and at a respiratory rate of 18, and that's normal. You're not using your chest muscles to breathe, you're not using any accessory muscles to breathe with, and your chest movement is symmetrical when you take a breath. So the next thing I'm going to do is I'm going to just assess your anatomical landmarks. I'm going to just palpate your trachea, and that's midline. And I'm just checking here for the substernal notch and the angle of Louis here, and also palpating the costal angle. And then I'm also going to look back here for the C7 and the T1. And if you just take a deep breath, and that is, we're just checking there to see that that's where the level of your lungs rise to when you take a breath. I also have been just listening to you as I'm talking with you, and I don't hear any stridor or wheezes that are audible, just to listen to you breathe. And so I'm also going to check your thoracic expansion, and I'm going to do that by coming back behind you, and I'm going to count down to the 10th rib, and I'm going to put both hands around you here, and if you could just take a deep breath again. That's good. Everything, it seemed to be symmetrical, and so the expansion should be equal and symmetrical, so that was normal. I'm also going to just feel here for any crepitus under the skin, which is a bubbly feeling, and it might be heard as a popping sound, and I don't feel that, and that's good, because that would mean that there might be some air under the subcutaneous tissues, and that might be indicative of a pathological process, so that's good. The next thing I'm going to check you for is the tactile fremitus, and I'm going to put my hands on your back here, and each time you feel my hands, I want you just to say 99.
99, 99, 99, 99.
Good. And I felt the vibrations under my hands each time that you said the word 99, and that's normal. I should feel that vibration. So the next thing that I'm going to be doing is percussion of your chest. So I'll just start, and I'm just listening. I'm going to check in between the intercostal spaces. Okay, let me check under your axilla here. Good, let me do your back. Okay, that sounded good. That sounds, it all sounds normal. the sounds went from dull and alternated with the resonance sound, and that's also normal. We expect to hear that. We're listening for any dullness, because that could mean that you might have a disease process going on, like pneumonia or something like that. So your lungs are good, they sound good that way. So the next thing I'm going to do is the measurement of your diaphragmatic excursion. So if you want to just turn around here to the side and lean forward for me, just kind of cross your, there you go. And what I want you to do is I want you to, in a minute when I tell you, take a deep breath, and I'm just going to percuss down here. Okay, take a deep breath and hold it. Okay, you can breathe out. I'm going to mark it here. And you can just breathe normal, and I'm going to do another percussion up your back. Okay. Mark it again here. And I'm going to measure that. And it measures at 4, and so that's within the normal range. We expect it to be between 3 and 5. Okay. We're going to go ahead and have you turn around here again. And I'm just going to listen to you breathe. I'm just going to also take your lung fields and just listen for the breath sound. So if you could just take a deep breath. Okay. Let me listen under here. Take a deep breath. Okay. Okay, good. Now I have listened to your lungs and all of the fields and everything. You have good, clear breath sounds. Abnormally, I would hear some crackles, bronchi, wheezes, or friction rubs, but your lungs are clear and your breath sounds are normal. And the last thing I'm going to do is the vocal resonance test. And when I put the stethoscope on your back, if you would just say the word 99, I'm just going to listen, okay? Just say 99.
99. 99. 99. 99, 99, 99, 99, 99.
Good. That was normal. I could hear I could hear the muffled 99 sound, and that's normal. That's expected to be able to hear that. And so that concludes the assessment of your lungs, and thank you very much.
Thank you.